You have a lot of fluid in your knee. See, you can kind of to help you with the knee pain. I'm going to remove the effusion. I've already cleaned up the knee with some betadine. I'm going to do it one more time. I'm going to spray a little cold spray, and then I'm going to inject some light. Now you see what's coming out? It looks like beer. It looks like beer. If it looks like beer, you're in the clear, just fluid because of an injury.
Right.
Now sometimes you take the fluid out and it's cloudy. That's a different type of problem. That way I can share it with somebody, people. So
yeah.
All right, see, so that's a second syringe. So if we were just doing this for diagnostic purposes, I'd say this is normal looking joint fluid. It looks like beer. So I like to say, if it looks like beer, you're in the clear. If it was cloudy, it would be more concerning that there's something different going on, maybe gout or maybe infection or inflammation, but not yours. Yours is like an injury problem. So just to remember, if it looks like beer, you're in the clear. If it's cloudy, it might be gout or an infection or something else, but that's all I wanted to just share with you, that you have normal looking joint fluid due to your injury. Taking this fluid out is going to make you feel a lot better. You need to find out what is going on here and why are you having this fluid build up. So what we'll do is we'll get an MRI and go from there. Okay, hopefully this will help you with your pain. Thanks.